I'm Dr. Jim Anderson, and I'm here to talk to you about restless leg syndrome. We know that restless leg syndrome affects approximately 10% of the population. And if you have restless legs, you probably are aware that there's no known cause and no known solution to really reverse the symptoms. Well, the good news is that over the past several years, we've had good success at reversing restless legs by using surgical techniques and also conservative techniques. We do this for people regionally and also for patients that fly in from out of state. We're doing it pretty much on a weekly basis. So we've heard your stories. I've heard a lot of stories about the misery that you're going through, the sleepless nights, the fact that maybe your partner can't get sleep because you're jerking at night. Your legs are jerking uncontrollably, maybe even tearing up those bed sheets. You have to get up at night. You get cramping in your legs. You maybe have to go for a walk, maybe take a hot bath. All these things you're having to do. It's difficult to go to a movie. You can't sit still, or maybe going out to dinner. In a lot of ways, it's hard to become social at night because you just can't sit still. And it's exhausting. Every day you wake up, you're exhausted, and you go through your day, do what you need to do, and the next night you're anxiously awaiting what's going to happen this night. And the worst thing of it, I think, is for many of you that you begin to question yourself. It kind of eats at your self-esteem because you begin to think that, well, maybe there is something wrong with me. Maybe I should be able to be stronger and handle this. And oftentimes it's maybe your relatives, well-meaning spouse, or maybe it's a doctor that you think just doesn't get it. And I think part of the problem with this is you're up suffering through the night while the rest of us are sleeping, and maybe it doesn't show during the day, but at night you're doing this by yourself. You're there all by yourself, searching for a way to get rid of this miserable condition. So again, the good news is we've been able to help a multitude of people. And I know there's drug options out there that a lot of you have been told about or are considering, or maybe you currently are on medication. But I'm not talking about that. We're talking about a whole nother way of looking at the cause of restless legs. And it's a non-drug treatment option. So for many of you, I think this is something that you should consider either now or at least learn more about for the future. So if you're interested, I would please ask that you consider our offer at this end of the video so you can learn more about the new approach to reversing your restless legs. Thank you for watching.